Hey everybody, how's it going? It's Dr. Tony with Spirit Physical Therapy. Today we're going to be looking at a couple alternatives to a standard bridge, and we'll explain why some alternatives might be helpful for you if you're doing home exercises or if you're a clinician out there and you have some patients who cramp up in the hamstrings when they're doing bridges in your clinic. Here's some good alternatives. So real quick, a standard bridge, essentially we're trying to get the posterior core and glutes working. So if I ask Chelsea to do a standard bridge right here, she's going to lift her hips up, trying to keep her core tight, and she's doing a great job with that. But like I said, you can relax. There's some patients who have difficulty with that because they're so deconditioned or maybe so hamstring dominant and got a lot of tone in their hamstrings that they're gonna cramp up there anytime they try a bridge. So here's a couple alternatives. What we can do is maybe extend the legs just a little bit more and get the patient to lift their toes up. And in doing so, their heels are gonna be able to dig into the floor a little bit more. And as she performs a bridge, I'm gonna ask her to also think about driving her heels away from her body. So that's gonna activate quads and neurologically inhibit or turn off the hamstrings. And you'll have a little bit of luck decreasing the tendency for those hamstrings to cramp with this style of a bridge out on the heels, driving those heels away from you. Good job, come on down. As another alternative, if we want to get a little bit more inhibition from the hamstrings, we can take just a standard hard foam roll. We're gonna put that under the distal thigh. She's gonna drop her legs down straight. And now I'm gonna actually ask Chelsea to extend her knees and lock them out straight. We've got even more quad activity here to decrease the hamstring activation. And then I'm gonna ask her, like usual, to tighten her core, drive up from her glutes, and hopefully this really recruits glutes and low back without making her hamstrings turn on and tighten up. So these are great alternatives for bridges without creating any sort of cramp, and then you can kind of progress from there. If you wanted, you could even take a TheraBand, put it around her toes out here, ask her to do a little external rotation of the lower extremities, a little abduction to work those hip abductors and external rotators as well. Just a couple little deviations of the standard bridge that I like to do in the clinic. So hope you enjoy that. Try them at home with your home exercises, try them with your patients in the clinic. If you've got other ideas, give us some feedback, and hopefully we're all in this together to get patients better. So thanks for watching.